Hi everyone, welcome back to my channel. My name is Stephanie and I am an internal medicine doctor and I make videos on health, wellness, as well as my life as a doctor. So if you want to follow along, click that subscribe button as well as ring the bell so you never miss a video. In today's video, I'm going to talk about over-the-counter pain medications. So I've received some questions through my Instagram about Tylenol and Advil, asking what's the difference between these two and which one's best for you. So I'm going to try and answer that in today's video, and hopefully you'll get a little bit more insight on some of these over-the-counter pain meds. Over the last few months, there's been a lot of mention over fevers, especially with the virus that's going on, and how to reduce fevers as well as reduce pain. So I'm going to talk about these two classes of medication that can help reduce fevers and pain. The first we have is Tylenol. So Tylenol is the brand name for acetaminophen or paracetamol, depending on which country you're from. And this is a medication that actually helps reduce pain. So it is an analgesic, so it has those analgesic properties. It is an antipyretic, which means it actually helps reduce fever as well. It does this by acting on a specific pain mechanism by inhibiting prostaglandin molecules that actually help promote pain and fevers and things like that. And this will help reduce the effect of pain that your body experiences through those receptors and prevent it from being transmitted to your brain. So Tylenol itself is generally a benign medication, but it does have a few side effects, and that can be based on dose. The maximum amount of Tylenol that you should be taking is less than 4 grams in a day, or 4,000 milligrams. So a dose of 500 milligrams, which is usually found in extra strength Tylenol, would mean that you cannot exceed 8 tablets of Tylenol in one day. Now, this can vary depending on if you have underlying conditions such as liver disease. So Tylenol is actually metabolized in your liver. And so if you do have liver problems, then you should probably be taking less Tylenol, if not none at all. So it's always important to consult your family doctor or other healthcare professional to make sure that you're taking the amount of Tylenol that you should be, or if you should be avoiding it at all costs. Some of the main side effects that can occur with Tylenol is, like I said, liver problems, but there is the possibility of overdosing on Tylenol, so if you take too much of the medication. And I've seen this multiple times in the emergency department where people have come in with Tylenol overdoses and required the antidote to help prevent the inevitable, which is either an acute liver failure or even death. So it is not a benign medication. It should always be locked up, and make sure that it's not near children who may not know what it is and accidentally take Tylenol. And if you do have liver issues, then you should obviously avoid Tylenol if you can. People who should reduce the amount of Tylenol that they're taking include those who do have mild liver disease. If you are someone who is dehydrated or malnutritioned, then obviously you shouldn't be taking this much Tylenol. Now, the other class of pain medications is something called NSAIDs, or non-steroidal anti-inflammatories. And things like Advil, Motrin, and Aleve are the brand names for medications that are within this class. Advil and Motrin actually contain ibuprofen. So you can also buy ibuprofen, which is a generic and not the brand name, but it's all the same thing. Aleve, on the other hand, is naproxen, which is also a medication that is within the NSAID category, but it's different than ibuprofen. These type of medications also act on the prostaglandin pathway to reduce the enzymes that prostaglandin uses to cause things like fevers and pain and inflammation. So NSAIDs have the antipyretic effect by reducing fever. They are analgesics, so they help reduce pain, and they also have anti-inflammatory properties, which is actually different from Tylenol. Tylenol does not have very good, if any, anti-inflammatory properties. NSAIDs have actually been used in certain medical conditions where inflammation is a problem. So if you have joint problems, such as in patients with rheumatoid arthritis, or if you have something called pericarditis, where you actually have inflammation of the pericardium, which is the liner of the heart, then these medical conditions can actually be treated with NSAIDs. In terms of the dose of NSAIDs that you want to be taking, so for ibuprofen, you do not want to exceed more than 1,200 milligrams in a day. So whether you have 200 milligram dose tablets, which is the regular dose of ibuprofen, or 400 milligram dose tablets, you don't want to exceed the 1,200 milligrams in 24 hours. For naproxen, I believe the maximum dose is 440 milligrams. So again, you want to take less than that, or usually it's about 2 tablets of 220 milligrams in 24 hours. If you do have any questions regarding the exact dose, make sure you consult your pharmacist. to ask them about how much you should be taking in a day. Now, some of the main side effects that actually can occur with NSAIDs is actually effects on the stomach. So NSAIDs can cause dyspepsia, which means that there's a lot of acid production and pain, so you'll experience pain like heartburn. It can cause peptic ulcer disease, where it can actually form ulcers within your stomach, or in worst case scenarios, it can cause GI bleeding. So this can occur if there's actually ulcers that begin to bleed. I've seen many cases of GI bleeding. Almost every time I'm working in the emergency department, someone does come in with a GI bleed. And this usually manifests itself through either really dark black stools, so the poop is black, which means that there's blood within it, or it could be when someone starts vomiting and they're actually vomiting blood. So when someone comes in with these types of symptoms and they've been on things like Advil or Motrin, or they've been taking high doses, then you're worried that there's actually some type of ulcer that's now bleeding. In order to fix that problem, usually the patient has to have a scope. So they have to have an upper endoscopy where the camera actually goes into their stomach, looks around, sees where there's bleeding, and actually can stop the bleeding at that time. And then you want to avoid NSAIDs at all costs. So that's the main side effect. Now, it's definitely a high risk in patients who have had GI upset or have had GI bleeds in the past. If they are older, so greater than 60 years old, then you want to be wary of taking too many NSAIDs. Or if they are just high-risk patients because they're on a high dose, given the fact that they're treating another medical condition. Other side effects that you want to be wary about is kidney issues. So people who have kidney failure or chronic kidney disease, they don't want to be taking NSAIDs because it can actually worsen their kidney disease. And finally, if you've had cardiovascular issues, so if you've had a myocardial infarction, which is a heart attack or stroke, it can be worsened by NSAIDs. And even hypertension. So someone who comes in with high blood pressure, and maybe they're on different medications, but their blood pressure is still high despite the medication, you want to try reducing or removing all NSAIDs from the patient's medical list in order to see if they can help reduce their blood pressure. So acetaminophen as well as the NSAID class are very good medications for helping pain, reducing fever, and NSAIDs for reducing inflammation. Obviously, given this day and age with opioids in terms of opioid addiction and opioid overdose, we want to try and save those medications for really severe pain and hope that people can really manage with Tylenol or NSAIDs in order to prevent things like addiction issues in the future as well as other overdoses. So these are definitely good medications that we have to help with pain. Now, of course, always consult your own healthcare provider, as these things may benefit you or they may not, depending if you have other underlying medical conditions. So always make sure that you talk with your doctor first before trying out these medications. Thank you guys so much for watching. I really hope you enjoyed this video and have learned some new information about pain medications. Please give this video a big thumbs up, as well as comment down below if you have any other questions about video topics that you would like me to cover in the future. Either comment here on YouTube or you can DM me through my Instagram, and I'll definitely be able to address your questions in another video. Also, be sure to subscribe to this channel. Make sure you hit that notification bell so you don't miss my next video. I hope you're doing well. I hope everyone's staying healthy and being happy, and I'll see you on the next one.